Are your checkups hiding risks? Every year, many older adults get regular checkups, thinking it's the best thing for their health. But what if some of these tests could actually increase your risk of a stroke, even overnight? It sounds unbelievable, right? You trust your doctor and follow their advice. Yet, there are hidden risks in modern medicine that often go unmentioned. Imagine leaving your yearly checkup feeling fine, only to experience dizziness, blurry vision, or something worse days later. You're left wondering what happened. The truth is, certain medical tests, especially if done too often or if you have specific health conditions, can quietly cause your blood pressure to spike, disrupt blood flow, and even trigger a stroke. This video isn't meant to scare you. It's here to inform you. You'll learn to ask better questions and protect yourself and your loved ones. After age 60, it's not just about finding problems early. It's about avoiding problems we might accidentally cause. In the next few minutes, we'll uncover 5 common medical tests that might carry hidden stroke risks for older adults. More importantly, you'll learn how to protect yourself before your next appointment. If you're over 60, type 1 in the comments. If not, type 0. And subscribe to Health with Age, where we share vital information. Let's start with the first test you should think twice about. But before we explore how certain routine medical tests might inadvertently raise your stroke risk and how they could quietly be impacting your overall health and well-being, here's a quick but important reminder. This video is for educational purposes only. Always speak with your healthcare provider before making any decisions about your medical care or health management. Your health deserves advice that's tailored just for you. Let's break this down. CT scans with contrast. Hidden stress on your system. If you've had a CT scan with contrast dye, you know that warm feeling. This dye helps doctors see your insides clearly. But for many older adults, this injection can stress your heart and blood system, especially if you're over 60 with high blood pressure, heart problems, or kidney issues. The contrast dye can cause sudden drops in heart rate and blood pressure, leading to dizziness or fainting. Or it can cause blood pressure to spike, tightening blood vessels and increasing stroke risk. Studies show older adults with pre-existing conditions have a higher rate of vascular complications after contrast CTs. For example, an 81-year-old man had a minor stroke 2 days after a routine CT with comparison, likely due to a temporary blood pressure spike. What many don't realize is that contrast agents are not fully eliminated from the body immediately. In people with reduced kidney function, which is common with age, these agents can linger and potentially cause further issues. The American College of Radiology recommends that kidney function be assessed before contrast use, especially in those over 60. CT scans with contrast are vital for serious conditions like cancer or blood clots. But they should be used carefully, not just routinely. To protect yourself, ask your doctor, is this scan essential, or is there a safer choice for me? Share your full health history, especially kidney or heart issues, and ask, can we do this without contrast? Sometimes a non-contrast CT or ultrasound is enough. Next, another common test with hidden risks. Stress tests. When too much strain is risky. Stress tests or exercise stress tests seem like a smart idea. Monitor your heart on a treadmill. But for those over 60, especially with high blood pressure or heart problems, this test can be risky. As speed increases, your heart rate and blood pressure rise, intensely straining your cardiovascular system. While fine for younger adults, for seniors, it can trigger dangerous blood pressure spikes, irregular heartbeats, and even tiny tears in fragile brain vessels. A 2020 study found nearly 7% of over 1,300 patients over 65 experienced harmful events during treadmill stress tests, particularly those with existing vascular issues. A viewer, Margaret, 74, with high blood pressure, suffered a minor stroke the day after her stress test, likely due to a sudden blood pressure rise. The test didn't directly cause it, but it stressed an already vulnerable system. Even pharmacologic stress tests, which use medications like adenosine or dobutamine instead of exercise, are not without risks. These drugs can cause sudden drops in blood pressure or provoke irregular heart rhythms, particularly in older individuals with underlying cardiovascular problems. Talk to your doctor. Is there a safer way to check my heart? Nuclear stress tests, using medicine, or resting echocardiograms might be safer. If you have no symptoms, ask if the test is truly necessary now. Next, another routine test with hidden risks. Endoscopy. Sedation and blood thinner concerns. Endoscopies are common, especially after 60, to check your throat, stomach, or colon. While sometimes necessary if you don't truly need it, and especially if sedation is involved, it might do more harm than good. Most seniors take medications, often blood thinners like warfarin or aspirin. When sedated, your blood pressure and circulation change. Combining this with blood thinners increases the risk of internal bleeding or brain circulation problems that can cause a silent stroke. A 2021 study found older patients, over 60, who had sedated endoscopies had more mini-strokes, TIAs, within 3 days. These were warning signs of brain blood flow issues. A 70-year-old woman had a mild stroke 2 days after a routine colonoscopy with sedation, likely due to a drop in blood pressure during sedation and her daily aspirin. The procedure itself might be low risk, but the combination of sedation, age, and medications can create a dangerous situation. Additionally, sedation drugs like midazolam or propofol can cause drops in oxygen levels and impair breathing, which puts extra strain on the cardiovascular system. For seniors with heart disease or lung issues, this can be especially risky. Don't agree to an endoscopy unless your doctor clearly explains why you need it now. If it's just a routine checkup, ask for safer monitoring, especially if you have no symptoms. Always remind your doctor about your medications. Ask, will I need to stop my blood thinner? What are the risks of sedation for me? If you're uncomfortable with sedation, ask for alternatives. Next, a test involving your kidneys. MRI with contrast. A kidney concern. MRIs are powerful tools, but when contrast dye containing gadolinium is added, caution is needed, especially for older adults or those with kidney problems. After 60, kidney function naturally slows. If your kidneys are weak, your body might not get rid of gadolinium effectively. This can lead to a rare but serious condition called nephrogenic systemic fibrosis, NSF, which thickens skin and tissues, and potentially subtle neurological symptoms like confusion or dizziness. A 2019 study found that about 5% of over 2,000 patients over 65 who had contrast MRIs reported stroke-like symptoms within a week, often with underlying kidney issues. Arthur, an 81-year-old, felt lightheaded and foggy for a week after a contrast MRI, later discovering stage 3 kidney disease. He wished he'd been warned. Recent concerns also suggest that gadolinium can remain in the brain and other tissues long after the scan. The FDA has issued warnings, though they state that the clinical significance of this retention is still being studied. If your doctor suggests a contrast MRI, ask, can we do it without contrast? Often yes. If contrast is necessary, request a kidney function test (GFR) first. Tell them if you've had strange reactions to imaging tests before. The MRI isn't the problem, it's the extra chemical your body might not handle well. With care, you can get answers without risking your brain or kidneys. Next, a test that might lead to unnecessary surgery. Carotid artery ultrasound. When is surgery really needed? The routine carotid artery ultrasound is a quick, non-invasive test. It seems perfect for prevention. But if you have no symptoms and your doctor orders it just to check, this simple test might lead to unnecessary surgery. Carotid arteries supply blood to your brain. Over time, plaque, cholesterol, or calcium buildup can form, which is normal with age. Not all plaque needs removal. Often, monitoring is safer than operating. Problems arise if the test shows narrowing 50 to 60%, leading to a referral for surgery like carotid endarterectomy or a stent. But if you have no symptoms, dizziness, vision changes, weakness, these procedures may offer little benefit and carry real risks. A large study found that for over 3,000 seniors with moderate narrowing but no symptoms, surgery didn't significantly reduce stroke risk more than medication and lifestyle changes. A small percentage of surgical patients even experience strokes directly from the procedure. Margaret, 80, had a carotid ultrasound that showed 65% narrowing. She had surgery and suffered a small stroke, now living with partial weakness. She wished she'd known doing nothing might have been safer. If your doctor suggests a carotid ultrasound and you have no symptoms, ask, what are we looking for? And what happens if we find it? Understand if the scan will change your treatment or just cause worry. If you're already managing blood pressure and cholesterol, extra tests might not change much. If you've had a scan showing narrowing, don't panic. Ask about repeat scans instead of rushing to surgery, and always get a second opinion before any vascular procedure. Taking charge of your health here is the main point. Not every medical test is dangerous, but not every test is needed, especially after age 60. Our bodies react differently. What seems routine, a special dye, medicine to make you sleep, or a scan can have effects we don't always see coming. A simple shot might raise your blood pressure. A scan might cause a reaction. Even a quick checkup can have risks if your body is already weak. That's why it's so important to pause, ask questions, and make sure every test fits your health needs, not just a checklist. You have every right to speak up, to ask, is this really necessary? Or to say, can we try a safer way? Informed choices lead to better health and peace of mind. Your health story matters. Your voice matters. We believe every choice should be based on knowledge, not fear or old habits. If you've ever felt strange after a scan or a test, or watched someone you love go through something unexpected, please share your experience by typing 1 in the comments. If not, type 0. Let's share, connect, and learn together. And if this video helped you feel more aware, more in control, or just more curious, subscribe to Health with Age. We're here to find the truth, ask the tough questions, and always put your well-being first.